A gunman waits for a CEO, shoots him at least once in the back and calf, and escapes on a bike. It's not your everyday headline. And the story gets even crazier when you look at how the public's reacting. This is the murder of Brian Thompson, the CEO of UnitedHealthcare's insurance unit, right here in Midtown Manhattan. A gunman's still out there. But what's really got everyone talking is what's going on online. It's not what you'd think.
You're right. It's really not. So today, we're going to be looking into these online discussions,
Yeah.
mostly from Reddit. Try to figure out this unusual response. Usually when a big name like a CEO is murdered, there's a lot of sadness and sympathy. But here, it's different.
Different is, well, maybe an understatement. People are saying they don't feel bad for Thompson. Some even saying they aren't surprised this happened. Why is that?
All the stuff you've gathered points to people being really frustrated with the whole U.S. healthcare system, especially UnitedHealthCare. And we're seeing this pattern in the online discussions. People are sharing personal stories about how they feel like the system's done them wrong.
It's more than just feeling wronged, though, right? These are stories about claims getting denied, crazy high deductibles, and this feeling that profits matter more than patients do. One user, Kazera Serafine, talks about how UnitedHealthcare wouldn't cover generic Adderall. During a shortage, they had to pay $200 a month instead of their usual $60. Another user, Super MR34, says their family's in debt because UnitedHealthcare wouldn't cover some medical bills.
These stories, even though they're just individual experiences, they're powerful.
Yeah.
Because so many people feel this way, like they don't have any power. They feel like the system is rigged against them. And when they try to deal with these situations, there's nothing they can do.
Anonymous Chaos kind of sums up this feeling in a dark but funny way. Imagine you go to a surgeon that's in your network, but then you find out the anesthesiologist isn't, and you end up with a $250,000 bill. And then, to top it off, your appeal gets reviewed by some AI, and it just automatically denies it. It's funny, but it also kind of hurts because it feels a little too real for a lot of people.
Exactly. It reflects a very real fear. A lot of Americans have it. This fear of being trapped in a system that doesn't care about their needs. And this brings us to the next big theme. The huge difference between what CEOs get paid and the financial struggles everyday people face, especially when it comes to healthcare.
Right. People are pointing out Thompson made millions as CEO, while so many others struggled to even pay for basic medical care. One user, Tillaler1, even mentioned this article from Forbes, showing that back in 2021, CEOs were making 324 times more than the typical worker. It's this idea of the haves versus the have-nots, made even stronger because Thompson worked for a company that a lot of people see as profiting from these struggles.
And Birdfoot 112's comment really brings that into focus. They pointed out that based on Thompson's salary, he probably made around $2,400 just during that 30-minute ambulance ride where he died. It's this, like, really unsettling detail. That highlights the crazy economic differences.
So we've got all this anger and resentment towards the healthcare system and this idea of the wealth gap. No wonder people are trying to guess why the gunman did it.
Yeah, of course. Anything we say right now is just guessing. But the theories that are popping up online give us some insight into how the public sees this whole thing. The most common theory is revenge. Someone who had a claim denied, or someone close to them, suffered because of a decision UnitedHealthcare made, maybe even leading to a death or financial ruin. It's a scary thought. But it makes sense considering all the anger towards the company.
It's like people get that feeling of desperation, even if they don't agree with the violence. There's also the theory about a disgruntled employee. UnitedHealthcare laid off a lot of people this year, so there are people out there who might be holding a grudge.
Right. Again, we're just speculating. But these theories show how this murder has become this symbol for these bigger societal fears. It's not just about this one CEO or this one company. It's about a system that many feel is failing them.
And that feeling of being failed by the system brings us to another important point. The lack of options for people who feel wronged by the healthcare system. People are stuck with huge bills, denied claims, and this feeling that there's no one they can turn to for help.
Exactly. And this lack of accountability feeds into this bigger problem of people losing trust in institutions. If you can't trust the system to be fair or to hold people accountable, what are you supposed to do?
It seems like some people are using dark humor to cope. I'm surprised by how many comments are using satire to point out how ridiculous this whole situation is.
Yeah. Humor, even when it's dark, can be a way to deal with tough emotions. Especially when something tragic happens, it lets people express their anger and frustration while still feeling like they have some control.
For example, James Markham's second jokes, $10,000 reward. Why, that's almost as much as it'll cost to get treated out of network, even though I'm fully insured by UnitedHealthCare. It's funny, but it also highlights this real problem. Surprise medical bills.
There's a lot going on in that one joke. It shows the fear of going broke, the distrust of insurance companies, and this sense that the system is designed to take advantage of people.
Another commenter, tactical breadstick, says, gonna need him to try some physical therapy before being declared dead. It's a dark joke. But it points to all the bureaucracy and red tape that often delays or denies people the care they need.
It's these kinds of comments, funny, but also making you think, that really capture how people are reacting online. It's a mix of anger, despair, and a desire for things to change.
It also seems like a lot of people are cynical about how the media is portraying this. A lot of users are questioning the narrative being presented.
You're right. There's this feeling that the media is focusing on the CEO's personal life, like his grieving family, his accomplishments, but they're ignoring the potential consequences of the decisions he made at work. It feels disconnected to those who see him as the face of a system that they feel has hurt them.
Eris puts it pretty bluntly. He is the head of something that shows zero sympathy for people we all love and has killed and bankrupted someone we know or love, so people are going to show zero sympathy back. It's harsh, but it really shows the anger and resentment people feel towards the healthcare industry.
That comment brings up a really important point, that people in positions of power, especially in a system as vital as healthcare, have a huge responsibility. And when people feel like that responsibility is ignored, there can be serious consequences.
So we have all this anger, cynicism, dark humor, and this underlying distrust in these online discussions. It paints a pretty bleak picture. But is there any hope? Could this tragedy, as awful as it is, be a catalyst for positive change? Yeah, it's easy to focus on all the negative stuff, but are there any positives? Could something good come out of this tragedy?
It's definitely possible. One thing that could happen is that this whole event could really get people thinking about healthcare reform and maybe even create some momentum for change. It forces everyone to look at a system that many people feel is broken.
So maybe this is what it takes to get our leaders to actually do something, to fix these big problems in our healthcare system. I'm seeing a lot of people online talking about wanting a system that puts patients before profits, a system where everyone can get affordable, good quality healthcare.
And it's not just talk. People are mentioning specific policy proposals, like expanding Medicare for all, lowering prescription drug costs, making healthcare pricing more transparent. These ideas have been around for a while. But maybe this tragedy will finally get people to pay attention.
That's good to hear. But even if we don't see big changes in the law right away, maybe this event can change the way people think. People are being more open about their struggles with healthcare, they're sharing their stories, and they're demanding better.
Yeah, it's about giving people power. Maybe this will inspire more people to get involved, to support organizations that are fighting for better healthcare access, or even run for office themselves. It's about taking back that control that so many feel like they've lost.
Hopefully this will make those in power listen. We've spent a lot of time talking about healthcare, but this case brings up some bigger societal issues too.
For sure. This incident has sparked conversations about corporate accountability, income inequality, even the stability of our society. It's making people rethink their values and priorities.
I saw one comment from Homebuyer Throwaway 89. They said, his net worth was $42 million. Should have retired. That's more than enough money. It made me think about how we define success and what really matters in life.
An interesting point. This case really highlights this constant pursuit of wealth and status. And it makes us ask, at what cost? Maybe this tragedy will inspire people to rethink their own lives, to focus on connection, purpose, making a positive impact on the world.
We've covered a lot in this deep dive. What's the big takeaway from exploring how the public's reacting to the CEO's murder?
I think the main thing is this case has exposed this raw nerve in American society. It highlights these deep anxieties people have about our healthcare system, the growing gap between rich and poor, and the fact that people are losing trust in our institutions.
But it's not all about the problems. These online discussions also show that people want solutions. They want a more just and fair society.
Exactly. And it's important to remember, these conversations are happening. People are engaged. They're sharing their experiences. They're demanding better. It's a sign that even in the midst of this tragedy, there's hope. Maybe this tragedy can be that push we need to start a national conversation about healthcare reform, corporate responsibility, and the kind of future we want. It's a question we should all be asking ourselves. What kind of world do we want to live in? And what role do we each play in creating it?
That's a great question to leave our listeners with. It's been a fascinating deep dive. Thanks for joining us.